All right, it is 8:45. Good morning, everyone, and welcome. My name is Megan Priolo, and I'm the Executive Director of CRISP. I'm very glad to be with you all for the 2026 CRISP User Summit. We have an exciting agenda in front of us, and we're joined by more than 1,300 participants from hospitals, practices, public health, post-acute, payer organizations, state and local agencies. Thank you so much for bringing your time and expertise to this summit. Your engagement is what makes this work possible and what drives better outcomes for our communities. Today's speakers include an outstanding group of leaders, subject matter experts, and innovators advancing meaningful change across Maryland's healthcare system. Just to give you a sense of today's agenda, we'll begin here shortly at 9 a.m. We'll have a discussion that focuses on optimizing rural health through telehealth and technology. This will be presented by Christian Millister, founder and CEO of Ingenium. Then at 10 a.m., we'll hear from Dr. Ben Wormser and Andrea Augustine from the Maryland Department of Health. We'll have a discussion around the modernization of maternal care coordination. Then at 10:30, excuse me, we'll hear facilitating care management follow-up and interventions after telehealth visits, which will be presented by Angela Hart from the Maryland Physicians Care, MCMI, and Mary Pohl from CRISP. Then we'll pivot and kind of dig in more from industry topics to a bit more on the CRISP tools. So at 11 o'clock, we'll have Jeffrey Bain from CRISP, and he'll walk through some updates related to In Context and Population Explorer tools. From there, at 11:30, Kate Talbert and Francesca Charles from the CRISP team will give us a first look at CRISP's new clinical reporting dashboards, which I know have been long awaited. Then at 12 o'clock, Maya Gottlieb from CRISP will present on understanding medication data across CRISP tools. And then at 12:30, we'll have a session that focuses on bulk referrals and improving care coordination. We'll have a great panel, including Michelle Norum from CRISP, Dr. Colleen Ennett from UMS, Taylor Pitts, the director of FAST at Meals on Wheels, and Bronte Nevins from Maryland Department of Health. Then we'll wrap up at 1:30. We'll wrap up at 2:30, but the 1:30 session will have the Patty Brown Innovation Award, as well as our CEO's closing thoughts. We're so grateful to each of our speakers for sharing their expertise and their practical insights, and we're truly glad to have all of you with us for today's conversations. Before we get started, I do want to cover a few housekeeping items. So firstly, all of the sessions will be recorded and shared on our website, as well as on our YouTube channel. So if you need to step away at any point, no worries, you'll be able to revisit the content later. Also, please use the Q&A feature throughout the day to submit questions or comments. You've probably noticed by now, but everyone is muted by default, really to just avoid that accidental background noise. So the Q&A tool is the best way to engage. You're also welcome to leverage the kind of upvote feature to click that button to like the question, and that will kind of further it up and raise it in the queue to be addressed. If your question is highly specific to just your organization or your use case, we do encourage you to follow up with us offline so we can make sure we're connecting you with the right people on our team. New this year, we are very excited to offer CME credits for physicians attending the summit. So physicians can earn up to 4 AMA PRA Category 1 CME credits. So to receive those credits, please click the evaluation form link that's in the event lobby. You'll just complete that form and submit it. Certificates will be sent within 1 or 2 weeks. And special thanks to MedChi for facilitating the CMEs for us. And we did add the CMEs in response to last year's survey feedback. Also, as part of that feedback, we've eliminated some of the longer breaks between the sessions. So you'll notice we kind of roll right through today. And users are welcome to leave and rejoin at any time. This allows us to wrap up a little earlier in the day as well. So again, this was all based off feedback from last year's event. We'll be offering a post-event survey again this year. So please do fill that out when you get a chance, since we really do rely on that information to improve our future events. Lastly, I want to thank our amazing CRISP team that put this event together, including Kevin Phillip, Jessica Heslop, Laura Mosier, the entire outreach team, MedChi, and everyone really who's speaking. and more. I'm sure I'm leaving folks out. But a lot of hard work that goes into organizing today's event is truly appreciated. And of course, a special thank you to our president and CEO, Craig Bem, for his vision and his leadership. So now we have about 10 minutes till we get started. So it's a great time to grab your coffee, your tea, your water, and whatever else you might need to settle in for the day. And we'll see you back here at 9 o'clock for our opening session. Again, thank you so much for joining us and welcome to the 2026 CRISP Summit.